All right. Good afternoon, everyone. And so we'll have some numbers for you today. As I said yesterday, we were watching those numbers increase, and I think we have some other things to tell you about today on that aspect, as well as we're continuing to work on a number of other areas at the ministry with our command table, making good progress on aspects related to lab testing, as well as with the ongoing aspects around PPE procurement, and continue to work with our federal counterparts on their new order, their quarantine order, and how we would continue to encourage you all to be doing your social, spatial, physical distancing with good consistency over this weekend. It's a key time. I'll talk about that in a moment. But let's go to the numbers, and I'll ask Dr. Yaffe to talk about the numbers for today.
Okay, thank you. So as of this morning, we now have a total of 991 laboratory confirmed cases of COVID-19 in Ontario. In addition, we have been notified of 2 deaths related to the outbreak of COVID-19 at Pinecrest Nursing Home in Popcajun. Now, these cases were not laboratory confirmed. However, they are included as part of our total numbers because we have already received confirmation that COVID-19 was the cause of the outbreak in the home. And this is in keeping with our provincial outbreak guidelines for all respiratory infections. In addition, we have been notified of a death in York Region involving a woman in her 80s, which brings our total number of deaths at this point that we are aware of to 18. And it brings the total of cases in Ontario to 993, which is an increase of 135 from yesterday. We do expect the number of resolved cases to go up quite a bit, well over 200 over the next few days. In terms of exposure, we are missing data still on about 40% of cases as the public health units continue to do their work. Of those we know about, a third had traveled in the 14 days before becoming ill. And it's the most common source of exposure has been in the United States. At this point, the United States has more cases than China did, 85,500 roughly, as compared to 81,340 in China. The second most common source is Europe. 10% of the cases had close contact with a confirmed case, and 16% had neither. So again, evidence of community transmission. We are aware at this point of approximately 60 cases who are hospitalized, and of those, 43 are in the intensive care unit. Of those 43, 32 are on ventilators to assist with breathing. Turn it back to Dr. Williams.
Thank you, Dr. Yaffe. And just in there, because we were talking about the couple things. The deaths, unfortunately, are continuing. In that, still in the high-risk category, mostly. Some related to the long-term care facilities that we update and continue to monitor in that aspect. So still dealing with an at-risk population that has been clearly noted. The lab testing, as yesterday, we remember I was talking about we went from 100 up to 170. We're down to 133. So that's a pleasant surprise to me. And added to the fact that we only did that, we also dropped the number pending by 940. So that was also an improvement, starting to make headway and move on those lab tests as more and more of our satellite laboratories are coming on board following their quality assurance checks with the Public Health Ontario Laboratory. So that means yesterday we went through nearly 3,500 tests. We wanted to be at 3,000 early by midweek, and I guess we've made that. And we want to try and move that up to close to 5,000 perhaps by the weekend. So we're optimistic that we can keep that progression going and keep dropping the pending tests down lower and lower. So the number of tests carried through, as well as the roll back on the pending ones, I was anticipating that our number would be higher than 170. So I am pleasantly surprised it's 133. I would say that's okay. Let's see where we go. It's only one day, and see how we're going to do over the weekend. As I said, this is now the second week of the critical 2 weeks I was talking about, and we have continued to do well in that regard as far as everybody adhering to the social distancing, physical distancing. The time is sometimes to get casual on that. Do not do that. Stick to staying at home. Sit outside in the sun for a little bit and do other things and activities. Keeping to smaller groups and keeping down to the distancing between, especially non-family members, if you're not in isolation in a family unit. If you're already in isolation because you're a case, you still have to do that distancing with your family members to try and prevent them from becoming cases. And that is another whole aspect that we've asked all along. There's a difference between isolation of your case versus self-isolation in the house, and monitoring those aspects. Of course, ongoing issues around hand hygiene is critical, as well as cough etiquette, etc. So the other aspects there on the federal level, we have trying to get more details on how they're going to undertake to implement the new quarantine order. The processes that are in place there, I'd still like more clarification on, and how as provinces and territories we would participate in that is an important question that still needs to be answered, and we're hoping to clarify that as soon as possible. But again, for those who have and are returning since the order came in, if you're symptomatic or asymptomatic, you have to do the quarantine for the 14 days, and we would strongly, and as the order says, require you to do so. At the same time, we want to make sure we're there to assist you so that you can do everything you must or can do to comply with the law, the national law of the quarantine order. And so we want to make sure we can make sure that you are not in a position where you're compromised with medications or other needs, that we could assist you in that regard. So as you see there, the numbers continue to rise across to our neighbor to the south, and some parts of the country were more worse hit than others. That's concerning to us. We continue to monitor that situation, as well as our province to the east of us, Quebec, and our counterpart there is dealing with a large number of increasing cases and also hospital challenges already occurring there. And we continue to watch and be appraised of it from their direction at this time. So those are the main comments I have. The main thing is that this weekend is the end of this real week of intensity. We want to continue it through the weekend. Be vigilant, be careful, keep that distancing going. Those that are involved in the essential retail industry, continue to respect the retailers, the vendors, the cashiers, and keep your distance from them at that time, and pay attention to their physical barriers, and so they can do their part to help you as a Ontario community undertaking this major action to stay the spread of COVID-19. And I can say it looks already that things are going well, but let's keep at it. We're not through this yet. This is not a sprint. It's a bit more of a marathon, but everybody, I think, is sticking to the task on that. So with that, I'm going to open up for questions.
Okay, we'll take the first question.
Alison Jones, the Canadian Press. Oh, hi. Dr. Yaffe, you had mentioned the outbreak at Pinecrest Nursing Home. I'm hoping you can expand on that a little bit. I know the health unit in its release mentioned that provincial guidelines said that after they already had a couple confirmed cases, they didn't bother testing the 30 plus other symptomatic residents. Can you explain a bit what's behind that regulation, why we do that?
Yes, this is a provincial guideline for respiratory outbreaks in long-term care facilities that applies to COVID-19 and other respiratory infections. And so basically it's saying that we need, it's about 3 or 4 positive specimens showing the same organism, in this case COVID-19. And if all those people have similar symptoms, we determine what we call a case definition. So we say all these people had, for example, fever and cough for whatever days, and within a certain time period. Then we use that, and anybody who meets the case definition is considered to be a case at that point without lab testing, because basically they are at that point a case. And we don't want to use up the limited lab resources to test everybody when we already know what the cause of the outbreak is.
Follow up?
Okay. Yeah, are you concerned then that because of those regulations and because we've seen several clusters now in long-term care homes that we're not really capturing the full scope of it?
Well, I think it's important to remember we're also doing what we call sentinel testing. And any respiratory outbreak in any long-term care facility now, the lab automatically tests for COVID-19 in addition to the other respiratory pathogens like influenza, which we still have, and other things. So, in fact, that's how we picked up that outbreak, through sentinel testing. So we're pretty confident that we're not going to miss an outbreak. And I think that the long-term care sector is very aware of this, and they're doing a lot of screening and active case finding and working very closely with the local health unit.
Next question. Next question.
Hello, doctor. Just wondering, do you have an age range of people who are in the ICU? Just trying to get a sense of how this is hitting the younger folks. I know some people in the 20s are in hospital generally.
I don't have that specific information at this point.
And all we have is from the national data, the hospitalizations, the median age is 50s. They didn't have exactly. So the tendency is they tend to follow much like our other demographics. But I think the point you're asking, as compared to some other sectors, are we starting to see younger people in that category? We have not been advised of that to an extensive amount, but as Dr. Yaffe said, we have not been given that data specifically from the various hospitals and acute care settings.
Follow up?
Yeah, just two more quick things. Any latest number on the number of healthcare workers infected? And we've had a few cases now of a grocery worker who died yesterday. Don't know if he had an underlying condition, if you could clear that up. And with the grocery gateway driver infected, do people need to worry about the grocery situation?
The information that I have received from the Durham Health Department is that the individual did not have underlying illnesses. I haven't received any update from them since yesterday. That may have been changed, but I don't have that information. I think that the information I have is he was only working there for 2 days. And so, to be honest, I think it's unlikely he acquired the infection there. I think that there's a lot of measures being put in place or have already been put in place in grocery stores to keep the workers safe and to keep the patrons safe. Certainly when I've been in the grocery store now, some of them have the plexiglass barriers. There's quite good signage about how to stay away, where to walk, and you have to bag things yourself. So, and a lot of extra cleaning, infection prevention and control, and specific times for more vulnerable people to shop. So I think there are a lot of measures that have been put in place to keep people healthy and protect them.
And as far as the healthcare worker numbers, I haven't got those in front of me for today. Yesterday we were at about 29 collective totally, and was getting some more in that number there. Again, we were trying to look at some clarification if we could determine how many were potentially on the job, if there was any nosocomial ones. That's the fancy word for that. But I mean, we'd like to differentiate because some are people who traveled during their times of holidays and may have contracted COVID by that way or from community contacts. So we're trying to see if we could differentiate that, because it is important to note, I think the main concern from some is how many did acquired while on the job, and that is a very important aspect for us to understand.
Okay, next question.
From Denise Paglinawan at your Reuters. Please go ahead, Denise. Unmute your line, Denise.
Hi, sorry, it was on mute. I'm wondering what's the status of the ventilators that you've ordered. I believe Premier Ford mentioned that some companies have offered to make ventilators. I'm wondering what's
Like yourself, I know we've had reports of the companies that have stepped forward with their technology to undertake that, Ontario companies. We know we did mention the 300 plus 200 that we had ordered anyways from our stockpile, so we have those. But it is encouraging some of the potential numbers, at least some of these companies are stating that they can move fairly quickly to produce and put forward. So I don't have those exact numbers, forecasts in that, but the main thing is that they have said they're willing and able and capable of producing those. And of course, they want to make sure they have their quality checks on the material before it's used for clinical or for public and patient care.
Follow up?
So does this mean we don't have a timeline yet for when we can receive these? Or?
I haven't received any timeline on that yet. As I said, we have a lot that are out there now that are not in use at the moment. We have more in the stockpile, but that doesn't mean we're satisfied to wait for that, and that's why the Premier and the Minister of Health have encouraged these companies to come forward, and we put in more orders accordingly, as everybody else is. And I think if we can have some that are produced or manufactured in Ontario, that gives us a much more guaranteed line of availability in the very near future, very close, but I don't know the timelines actually.
Next question.
From Phil Perkins at CHCH News.
Hi there. So I just have the one question. Obviously, everyone got the text alert test. I was just wondering, why are we only implementing this now, seeing that, as we're mentioning days before, we were expecting, 2, 3, 500,000 Ontarians coming back from March break. Why are we just starting the text message system now?
Well, we've had discussions to say with looking at all our public health measures, what's working well, what's not working so well. How do we keep enforcing the message and to bring it across? So that we found people from the newness of it with the emergency order, followed up with the federal quarantine orders. There's a number of things, but after you added a number of days, some people may say, I guess this is not as big an issue as before, so we thought it was a good reminder to get out and tell people, this is still on. You still need to pay attention. This is whether it's a time prompter or a timeout alarm, and this is another way to do it. So I applaud the system for putting that in place.
Phil, just making sure you don't have a follow-up.
Are we getting these daily? I wasn't too sure. Sorry, I do have a follow-up now. Are we getting them daily, or how are they going to be spread out?
I haven't seen the actual timelines on that. I guess I'm going to have to be surprised and keep alerting me on those different times. So I don't have that, but we can get back to you if you have some more details on that.
Next question.
Randy Rapp at CHCH TV.
Yeah, hi, doctor. I'm wondering, is it still safe to use cash? Coins and bills are passed back and forth between numerous people in a single day. Is that a good practice?
Well, maybe
go ahead. You go ahead, Dr. Yaffe.
I have to say I haven't used cash in a long time. But I would say that if you're using cash, and sometimes there is no other option, just make sure to wash your hands or use alcohol-based hand sanitizer after touching it. Certainly before you eat or touch your face in any way. But it is preferable, I would say, to use other sources of money if you can.
Follow up?
And we've recommended to the retailers that they wear gloves when they're handling cash. That's why they wear it. And there's some of our demographics, especially some of the older clientele, are not that familiar and at ease to use the cards, etc. And they may still insist on using cash. So we're trying to accommodate that if and when they have to come out. We'd rather they didn't come out. We'd rather that someone else go and get the things for them, especially those over 70 with other health conditions. If they're really forced to go out and have to, I know there's special times offered by various vendors, but it'd be preferable if you had someone in the neighborhood said, if you need something, we'll go and get it for you, and we'll help you out in that way, and we'll drop it off at the door. You don't need to take a chance and take a risk that way. So we want to look out for our vulnerable populations among us, and the seniors are only one group. There's many others too, and committees are working on different aspects. So sorry for interrupting your question. Go ahead.
Yeah, is there a way to sanitize cash? And also, does the same apply to lottery tickets?
Yeah, I was asked about with the OLG and the different things because some people, their lottery tickets, they have gone over to a system you can do it all electronically. So you really don't have to go in and do it personally. You'll get your rewards and that money sent out. I know everybody likes to hear that tune, winner, and whatever, and it has that sort of feedback. But I think it's better if you did it electronically. You can purchase other ones online. So they have tried to accommodate that and to make it as user-friendly as possible. So both ways, there's ways to avoid using the cash or avoid using the paper handling of the lottery tickets. I know for some, especially certain demographics, that's not what they're used to, but it may be just part of that adapting during this time, not having the tactile and going there physically and hearing the tune or whatever. It'd be safer to do it electronically, and sometimes someone may have to who's not infected, maybe give you some assistance on the phone to say how to do that, how do I log on. So we're trying to assist in any way possible to reduce the usage on both grounds.
Next question.
From Snedegal at Queen's Park Briefing.
Hi, doctors. Thanks for taking our questions. I'm just wondering, this afternoon, Premier Ford said his goal is mass testing, and the province had placed some very large orders for new technology. Could you clarify what technology that is and how the province hopes to use it?
Well, I can answer in general. I'm not a microbiologist. I don't work in the lab, but I know that up till now there have been issues around the swabs, which they have resolved. Then there were issues around the reagent that's used to get the RNA separated out, and they've solved that, and they're using different kinds of reagents, so there's redundancy in the system so that they're not depending on one particular supplier. We're also expanding how many labs across the province are doing the test, both in hospital labs and in some commercial labs, and creating a provincial network that to coordinate the testing so it all doesn't get to one lab and backlogged. So there are a lot of different mechanisms being put in place that are going to increase the ability, the capacity to test quite a lot. It's already in place, and it's getting better and better.
Follow-up?
Yeah, so just in terms of, so I guess, like, is the new technology just using different types of reagents, or is there anything else that's maybe being considered at this point to further create that capacity for, mass testing, as we're seeing other countries exploring different options?
The labs are definitely looking at other kinds of tests that are being done in other countries. For example, the serology or blood test for antibody levels that's in use now in the UK, and other kinds of point-of-care testing, and they're all being considered for use. But and if we find that they're valid, they're sensitive and specific enough to identify people who are infected in a way that's useful, we will definitely be implementing them. But at this point, we're still with the PCR test, polymerase chain reaction, which takes you a while to remember those words. But anyway, it's basically a test that multiplies the virus so they can identify even the smallest piece. And it's a very sensitive and specific test that's done right now. And as I said, more and more labs in the province are growing their capacity to do the test and to coordinate so that we have the maximum output we can.
Okay, next question.
From Mo Sahim at Vista Radio.
Hi, thank you so much for doing the update. So my question is specific to, I guess, directed to Dr. Howard. So with Ontario Labs dropping the pending number of cases down by 940, as you said, and the drop in number of new cases today, what would you say to anyone who would think this is us coming out of the peak?
I'll take, you mean Dr. Howard, you may referring to myself, and then that's Dr. New at the federal level.
Oh, sorry.
Yes, that's okay. I'll try and answer that one there. As I said, the number, we had yesterday 10,000, nearly 11,000 tests pending, and today, even with a larger volume being submitted, we dropped that number down by 940. So we started moving on the backlog of tests there, and we're hoping to get that right back down for two reasons. One is we don't want people to have to wait any longer than they can. We want to make sure we can get back to that maybe 24-hour, 36-hour turnaround, and for priority ones, even quicker. So we want to improve our timeliness as well as our volume capacity in that regard. I think the point that you asked about, and that's what I was trying to say in my wrap-up before the questions, is that while a 133 number is down from 170, and I may take, I'm a bit surprised it has dropped down, I take it just one day, and I want to see what happens over the next number of days. So it may be, I've seen this before, where it dips down a moment, and the next day it's up to over 180 to 190. How those samples came through, we don't have any control. What percent are positive at that time? They're not in any matched way. It just, they progress through. So I would say the fact it didn't go up by a big number is reassuring. The fact they went down is not something I can draw any conclusions on. I want to see what the next number of days demonstrate.
Okay. Next question.
Thank you. Thank you. And the next question is regarding PCR testing. So my understanding of PCR is that A, it requires equipment, really good equipment, and B, it also takes time. And I also know that from personal experience that universities across Ontario usually have some pretty high-level labs pertaining to these kinds of processes. I guess my question is, why are we not using those?
Well, again, there's a whole group looking at the lab capacity issues, and I'm confident that they have looked at university labs. I know for sure they're working with the University of Guelph, for example, and I think they're working with a lot of universities, but the beginning was to focus on, obviously, Public Health Ontario lab, hospital labs, and community labs. But we are obviously looking at every potential lab that could be doing this work.
Okay, we have to move on. We're going to go off the phones for a minute and go to Jamie, who's in the room.
Doctor, good afternoon.
Talk louder.
How many operations are being canceled, or how many cancer operations are being canceled as a result of this crisis?
Well, when you say cancer operations, that's a wide range in there. We have, and I have received some emails from concerned family members or actually individuals about that, and we have quickly moved those back to our regional tables that they would go to the respective hospitals and ask for clarification. Is this really a type of procedure that can be canceled? Because there's elective and there's one that is urgent. There's some that are not urgent but not elective, and you have to weigh that out. And so I think it's my assumption that the individual, maybe it wasn't explained carefully, they didn't understand it. So we don't want to step in the middle of an ongoing patient care protocol. So, but I do think those individuals deserve to have their questions answered by their healthcare provider and by the institution. And so I would much rather it be dealt with on a one-on-one, because each case is unique. Unique in its challenge, and issues have to be dealt with, and it is a decision that when you make that to choose it's elective, the physician has weighed out all those aspects, and is the client in that situation being put more at risk by delaying. I think that has to be weighed out, and the institution and the overseeing physician has to be satisfied of the ongoing safety and health of their patient.
Follow up?
I'm sure you can appreciate the anxiety that would a person would go through when their operation is canceled. Not what you have to say to them, but is it not vital that these people get to have their operations given the circumstances? And what do you have to say to that person?
I think there's a broader question there, and that's as we go through these measures to prepare for large surges in COVID-19 cases, and we try to make up some buffer or free up beds and that for that functionality, because it can come on very quickly. And even if you're sitting in your bed waiting for surgery and you're always told it's at the moment canceled, you have to move off because you have to bring in 2 or 3 more people on ventilators, etc. We want to make that room. At the same time, if you go too quickly ahead, there's other things that go on. Life goes on. There's cases go on. There's strokes. There's heart attacks. There's cancers and different things like that. And we don't want to by responding and preparing to cause more harm by doing that. And so I think there's a very, very carefully thought out balance on how to make that happen. So what we're trying to do through our public health measures, through the social distancing, through the physical distancing, and through our assessment centers and through our self-assessment forms is ask people, one, don't overload the hospital system. Save the hospital system in that way. Save it not only for COVID-19, but more, save it for those who really need to get it when they need to get it right now. And so we've got to keep that rolling. And that's why a careful, I would say, auditing of all those ones, very carefully, ethically, is this one that can be deferred, noting the situation of the patient, their condition, their emotional state, the family issues. These are all things that weighed in there. And so while we want to bring around this preparation, we don't want to compromise the system such that those who need the care should get the care, even if it isn't COVID-19.
Okay, we have to move back to the phone lines. Next question.
From Haley Cooper at News Talk 1010.
Hi, Dr. Yaffe. Hi, Dr. Williams. The 16% of cases that represents community spread, is that figure higher or lower than what was forecasted or expected at this point in the pandemic? And what does it tell you exactly?
Well, first I think we have to remember that about 40% of the cases we don't have any information about their exposure. And there's probably a lot of reasons for that. And I think one of them would be that people can't remember exactly where they've been and who they've been with for the 14 days before they became ill. If you think about it yourself, can you remember exactly where you were and who you were with for the last 2 weeks? So this is a limiting factor, as well as the health unit, of course, capacity to do the interviews and the re-interviews to try to get this information. Keeping that in mind, so of the rest of them at this point, as I said, 16% have no history of travel or contact with a confirmed case. So what does that mean to me? They obviously got it from somebody else, and they got it from somebody else in the community that, either where they live or where they'd been in the 14 days before they became ill. It's of concern, obviously, and it's something that we're working with the health units to try and increase their abilities to do more contact follow-up, more case management, because this is kind of the basic bread and butter of communicable disease control.
Okay, follow-up?
And I just want to clarify, the goal is, or the hope is, to be completing 5,000 tests a day by the end of the weekend?
Yes, that's the plan, as the Minister Elliott had announced, and we were striving for in the lab, and the Public Health Ontario felt they could do so with our consultants. So as I said today, we're up to about 3,500, and the different, the other 9, almost 11 satellite ones are finishing their quality checks with Public Health Ontario, so they can start doing their own, and then they don't have to use up some of the lab testing capacity at Public Health Ontario to do those quality checks. So I'm fully anticipating, looking forward to over the weekend, we would be up to 5,000. We might even go beyond that, and that would be a nice, another pleasant surprise to have, but we seem to be on track for that.
Okay, I think that was the last question, so we're wrapped up for today. Thank you.